Welcome to GME Admin Insight, the podcast dedicated to the GME community. I'm your host, Natasha Brox, and I am thrilled to be back with you today. On my podcast, I talk a lot about professional development, growth, connections, networking, and I like to have people on the podcast that bring that same energy as far as insight and growth and meaningful information to the GME community. And with that, today's guest, I have Henry Lewis. I'm so glad you're on today, Henry. Thank you for being here.
Thank you.
So let's discuss a little bit about Henry. He is a dedicated professional committed to health and wellness for the public. And we all need our health and our mental wellness, so that's great. With a diverse background and extensive experience, he has played a pivotal role in shaping the healthcare workforce in Commonwealth, Virginia. He serves as a senior residency program coordinator in the Department of Internal Medicine at VCU Health. He's the director of recruitment and student programs for the VCU College of Health Professionals and academic advisor for pre-professional health students at VCU. That is a lot, Henry. His contributions extend beyond administrative roles as he has presented and published on critical topics such as diversity in the healthcare science. Henry holds a Master in Science in Clinical Nutrition from Sonora University Health Science, a Master of Arts in Student Affairs in Higher Education from Indiana University, Pennsylvania, and a Bachelor of Science in Health Education in the University of Florida. I think that's amazing that I want to say that two masters and a bachelor. So, that's amazing. And additionally, he is a certified healthcare education specialist, showcasing his experience, his expertise, and commitment to promoting health, which is why I was like, I have to have him on this podcast because this is some great information. I seen you on IG promoting health. It was like every time I looked up, you were promoting health, promoting health, promoting health. And then I watched you go from one institution to another, right? And I was like, okay, he's doing some big things. And I was like, I have to have him. I have to speak with him. So thank you for being here, Henry. Thank you so much. And let's just go into your journey. Let's just talk about like your journey because you masters, a bachelor's, everything that you're doing. So and being committed to, health, which is great.
Yeah, absolutely. Well, first off, again, just thank you, Natasha Brox, the Natasha Brox, for having me on. I've also watched you on social media be a leader in GME and, really showcasing what it means to be excellent in GME. So thank you for having me. I'm honored and privileged for this. But I love that question because again, I don't get to talk about this very often. So this is exciting. But so I'm from South Florida. I've done a lot of work in Virginia, but I'm actually from South Florida. I don't know if I initially mentioned that, but I got my undergraduate degree from the University of Florida. So I spent a number of years in the state of Florida. But I initially went to school to become a physician.
Oh,
I,
really?
I was health education on the pre-med track. And, while I was getting my health education training, learning all about health disparity, social determinants of health, public health, community health, all of that kind of stuff, I was taking pre-med classes on the side with that major. And it was my last semester of college, I want to say. I did an internship at the University of Florida's Diabetes Center of Excellence. It was called that at the time. I think it's called something else different now. But it was their diabetes center pretty much. And they had an outpatient care for served in the, I think they call it North Central Florida. But So I was working alongside certified diabetes educators, going to patients' rooms, showing them how to inject their insulin, teaching them how to carb count. Like it was very, very clinical,
Wow.
because that was the path I was planning to head down. And one of the biggest issues that I ran into in that internship is, even though I don't think I knew what this term was then, I started learning it from experience, which is I started learning what social determinants of health were.
Mhm.
I'm here helping to provide clinical care to you, but you don't have access to healthy food. You
Mhm.
don't have access to transportation.
Mhm.
You don't have access to affordable housing.
Mhm.
You don't have the social environment and the physical environment to be healthy. So, how can I tell you how to use this insulin that you can't even afford?
Right. You may not even be able, you may not pick up.
Right.
Wow.
Yeah. Right.
That's
And,
terrible.
and not that the clinical care is not important, but that was kind of one of the first times I really started seeing this healthcare issue is a lot bigger than just patients coming to see you needing medication and going home. It's way bigger than that.
Hmm.
Um, and I was frustrated with the system,
Yeah.
um, very frustrated. So to the point where I stopped being pre-med and I said, I need something else.
Really?
Yeah, I need something else.
Wow.
Yeah, yeah.
That's crazy because, like, for GME, you never know someone's story,
Mhm.
first of all, when they sit in the seat. But then to learn, like me learning now that you were pre-med, you never know anyone's background. Okay. Which is one reason why I like doing this. And then two, your route changed dramatically from pre-med to what you're doing now, but you're still in the healthcare field.
Mhm.
So you still decided to be here. It's crazy because like when I was growing up, I was always in the healthcare field too. I wanted to be an obstetrician,
Mm.
but
Oh, awesome. Mhm.
but
You
once
still can.
oh no, I'm not cut out for it. When it came to the anatomy and the blood and the guts and the stinking, I
Mhm.
couldn't do it. I
Yeah.
it just I didn't know that my stomach would turn that easily, and I was like, well, I still want to be in the healthcare field, so let me help the people who can do.
Mhm.
And even though I wanted to be in the OB, program or whatever, it just happened that, here I am now. But like you never know someone's path that they're on
Mhm. Yeah.
within the GME community. And a lot of people are like, well, I just landed here. But there are many of us who wanted to be, in healthcare
Yeah.
in some type of role.
Mhm.
Wow, you
It's something.
gonna be a
Yeah.
doctor. Wow, that's just which now it makes sense on all of the healthcare things that you do.
Mhm.
Now it makes sense. Okay.
Yeah. Yeah. Yeah,
Wow.
and so interestingly, I actually, after that experience, I didn't go into healthcare at all. I actually went into higher education administration, because while I was, studying, completing my degree, I was involved in a lot of student leadership opportunities on campus at the University of Florida. And that experience was just so exciting. Like I was an orientation leader. I used my health education background and worked they call them wellness educators. It was like the student health
Yeah.
center. And
Yeah.
we would have like little huts around campus and give out like sexual health resources or
Yes.
what have you. But I was just involved in all these student leadership opportunities. I said, oh, this looks like an amazing career. And interestingly, my father actually worked in higher education for over 30 years. And I knew that, but I didn't really realize how much I would have loved his type of role
Mhm.
until I started engaging in those student leadership opportunities myself.
Mhm.
So after I got that frustrating experience with the healthcare system
Right.
in my internship, I said, well, what am I going to do? Because I've been on this path for so long. Since I was 5 years old, I said I was going to be a doctor. And I thought about those student leadership experiences. And I said, well, you know what? This is what I'm going to do. So I ended up getting that master's in student affairs and kind of going down that path for many years.
Yeah.
Yeah.
So do you think like your experience with being in the diabetes role that really sparked your, your pursuit of a career in health and wellness for the public?
Maybe subconsciously.
Hmm.
There's another experience I'm going to talk about in a minute that really catapulted me into that work.
Hmm.
But sometimes when I think about it, I'm like, well, I've had these milestones within my life that prepared me for this moment. So maybe subconsciously
Right.
that experience, because yeah, especially all of the nutrition and the carb counting that I was doing with patients, sometimes I do think about that experience when I do some of my own health and wellness trainings. So
Right.
maybe, yeah,
Because
absolutely.
I was just thinking like, so you did that and then you were an educator, you put that together, it's like you're still teaching and now you're
Mhm.
teaching in a healthcare environment and you were in a healthcare environment, you wanted
Right.
to be a physician and,
Mhm.
so your path was going to lead down there anyway
Yeah.
from everything that you've done. Wow.
Yeah. Yeah. It's very interesting how, things kind of merge and come together and I mean, all of that. It's so interesting. But after I went and pursued that higher education student affairs degree, I moved to Virginia, and so this was 10 years ago, and I had the role of an academic advisor for pre-med students. So it was interesting how I was a pre-med student, and then now I studied education, and now helping students get into medical school and dental school and pharmacy, all the different health professions. And I did that for almost 5 years, I want to say.
Oh, okay.
Yeah. So, and I did a lot of different things under that hat. A lot stuff I wasn't even trying to do, but it just kind of
You
formed
got
into things. Yeah.
more skills. You got more skills just to
Yeah.
house you, to keep you where you are and that you can uh, pull out and use later.
Hmm.
That's how I always look at it, when we do different things that, I always call it eat and anything else asked of us.
Yep. And there was a lot of that, a whole lot of that. But, one of those things that was kind of just put on all of our plate was to create a campaign, an academic advising campaign for a population that we felt needed some additional advising support. So I created this campaign called the Black Men in Medicine
Yes.
Academic Advising Campaign. And because I didn't see many Black male
I-
students
I've
trying
seen.
to become doctors.
Mhm. Yes.
Once
Yes.
I started that campaign, then it's like they started coming in. I was like, oh wow, there's a whole community of them that I didn't even know about.
See, they start reaching out to you and, oh,
Mhm.
wow.
And I
Wow.
mean, and then it just grew into, I mean, this entire movement. It's a registered student organization at VCU. And it's been the organization has been in existence for 7 years or almost 8 years, but the campaign actually started about 9 years ago.
Okay.
So, and it's still going. Yeah, still going.
So you were with VCU Health and then VCU College of Health Professionals. That are those two different hospitals, or is that like a school? Okay.
Yeah. So when I was an academic advisor, I was with the university. So I was with Virginia Commonwealth, just university. Um, and then I went to the College of Health Professions, which is also with the university, and I
Okay.
was in that recruitment role. And then I went to the VCU Health System, which is a separate entity, but still all under the VCU hat.
Okay. Okay.
Yeah.
And right now you're a director of recruitment and student programs.
No, so my current role is I'm the program manager for the Virginia Health Workforce Development Authority. So
Okay.
actually, I don't even work. I left VCU this past January.
Right. That's right.
Hmm.
Right.
Yes, past 9 months, I guess ish. Yeah, I've been with this healthcare workforce authority. So we're like a quasi state authority that helps manage healthcare workforce strategies for the state.
Oh, okay. Okay.
Mhm.
Still teaching, still teaching. You're still out there teaching.
Yeah, it's still some of that going on. Absolutely. Yep.
I remember that because I remember when you left
Hmm.
Commonwealth, you had made a post like, I'm leaving Commonwealth, but I'm not leaving the healthcare, the thing that you brought, just had a brain fart.
Oh, the Black Men in Medicine.
Yes.
Yes.
And
Yeah.
you still going to be doing health. And I was like,
Yeah.
yeah.
I'm still serving as like a co-advisor uh,
Okay.
to them, so I still go over to VCU sometimes to help with that. But yeah, yeah,
Okay. Because I was like, no. But when you said that,
yeah.
I was like, okay, great. Because I was so inspired when you started that and you had that on the post. I was like, this is what, especially, the Black community needs. You need to see us, especially as
For
doctors.
Black male doctors. Yeah.
Yes. You know, our men to look up to, the little boys, our teenagers, our young
Yeah.
adults, somebody, a positive life that they can, look up to.
Mhm.
And I was really, really inspired by that. So thank you. Thank you for creating that. And then they came out in droves, to hear that they did. So they was like, no, we here.
Yep.
Recognize.
Yep. Yep.
Okay.
Yeah. There's many of them now.
So what do you think, like what you do now, and then you being the core, you was a senior program coordinator, right? How do you think that's different, or do you think um, there's a difference between the two? Did you use something from you being a program coordinator, like that guided you, or that you use in your role now? How do you think roles shape your perspective in healthcare and education?
Yeah, well, great question. So obviously, and because you've worked in that role as well, but as a coordinator, I did it for almost 3 years, and they always say it takes about 3 years just to understand
Yep.
the work of GME because GME was just I had no idea what it was before I started in that role. And I'll talk in a minute how I even got to GME in the first place, but being in that role, it was the first role I had where pretty much my job was already laid out for me because of the requirements for the ACGME and just things are already
Yeah.
how we are in GME, things are already pretty much set, and you
Quality.
have deadlines, you have policies, you have requirements, and you have to meet them, and that's it. There's no there's no questions, there's no ifs, ands, or buts.
Yeah.
So it was very, very structured, and that really learned like the accreditation process and what it means to be in compliance. So I never really had a role like that in that kind of way. Um, so when I came to this current role with the Healthcare Workforce Authority, my role more so now is supporting our graduate medical education funding program. So we provide supplemental funding to residency programs in Virginia, particularly those that are in rural and medically underserved areas that would like to expand their GME programs, and they want to have more slots. They got approved for more slots through ACGME, but they kind of need the funding to help
Yeah.
support these
Yes.
slots. So we work on that program. But I think being in my previous role and understanding accreditation and just requirements and understanding, psych residency is 4 years versus 3 years with internal medicine.
Yeah.
Having that knowledge and being able to educate our staff who hasn't really had that type of experience is really helpful.
Wow. Okay. Yeah,
Mhm.
I'm gonna have to get with you because on this because coming down to Georgia, I am starting a brand new program. Like they have none at all.
Mm-hmm.
Rule. And they did get some grants, but
Yeah.
I was like, why did you only get this amount? You could have got more. And you know, but if you don't know, you don't know,
Right.
right? So
Right.
you have to pick your brain about funding.
Yeah.
If
Absolutely.
there's anybody in the Jimmy community, you can reach out to Henry Lewis
Uh,
for funding. I'm pretty sure he will have some good nuggets that he can share. Uh,
yeah. We're learning. It's a learning process. We are learning.
it sure it is it's a huge learning process, but
Yeah.
see, but that's something that I always try to push people. You could do like a presentation on,
That's
um,
that's
or abstract on, or
right, right,
abstract, you know,
right.
like just the steps that we need to take.
Yeah.
Especially now, CMS has granted, so much money, and programs are trying to expand or
Mhm.
this one even start programs. So, that's just something that, maybe you could, or we can have another podcast about.
That's right. Yeah. Looking forward to
Be
it.
fully up. But
Yeah.
no, that's good. So your GME program coordinator experience has helped you in this role.
Yeah.
All ties in together. I like that. And I love your
Absolutely.
passion
Yeah.
for like health science, diversity in health science at that. I
Hmm.
love that. I love that because you don't see a lot of it out here, today. And that's something that, when they talk about DEI, it's like, oh, but are you really doing DEI? So I like the fact that you stepped out there and you've done a lot of things with that. That's why I was like, I have to have him on there.
Oh,
So yes. And then I noticed that you did present or you published on this topic. So take me through that. Like, how was that? Share what you what
yeah.
you learned and everything from working on that.
Yeah, so I published various different times in my short career, but when I started the Black Men in Medicine program, initially, again, it was an academic advising campaign. So I partnered with another academic advisor at VCU, and we wrote about using advising technology because a lot of what we were doing with the campaign was, loading these students up into some type of advising online system that can kind of track where they're going and follow up with them and kind of hold them accountable. So he wanted to present about that platform and use my actual campaign to give people an example of some of the things that they can do. So after that presentation, we ended up writing about it and publishing it in the academic, the what is it called, the it's like the Pre-Health Advisors Journal with the big national organization for pre-health advisors, NAAHP, I think is the name. So that was the first thing that I wrote and then or co-wrote. And then I wrote a case study for working with Black male students who are trying to go to medical school for a student affairs textbook. So other student affairs professionals who are in their master's or PhD programs training. Um, my old professor is one of the co-authors of the textbook, and he asked me to write a case study for the textbook. So I've done that. And again, that's to help professionals in higher ed work with Black male students who are trying to go into medicine. And I would say the last, because I think I have three publications, the last one I did was recently, and that was a GME publication on some of the work that my friend and colleague, Dr. Omar Young, he's an obstetrician, gynecologist, and maternal specialist, but he and I started a podcast called Bro Doc Talk, where we talk about different issues facing Black men and women in medicine. And I kind of do more editing with the podcast now. He has his co-host is another physician, so I've kind of moved on from that. But we wrote about our experience doing that and the connection to e-mentorship for Black students going from medical school to residency, and how e-mentorship can be very helpful when there's lack of in-person mentorship that a lot of our Black medical students, tend to have when they're in their medical education.
So it's a more of an electronic type of medical. So they are still paired up with a mentor, and so they just do like a Zoom type of counseling.
It's not really pairing, but it's providing kind of like an asynchronous opportunity to learn from. So like kind of like this, we'll interview other Black physicians and talk about their experience, have them give advice, and then we send out the podcast, throughout. So they're learning from these physicians that look just like them, and oftentimes they're reaching out afterward and saying, hey, I want to meet this person. I've listened to this podcast. I want to meet them. So then we'll then share their contact and they'll, go on to develop their own, relationship.
Oh, that's good. That is good. And especially with a podcaster like that, that you can listen to it over. Like
Right.
you may there's something may draw you out. And then you're like, oh, but then you can go back and listen to it and you may hear something different or,
Mhm.
write
Right.
it down. So that's good. I didn't think about that.
Yeah.
That's good. Instead of the whole one-on-one, you can get a variety.
Yeah. Yeah.
Everybody thinks differently. They will say something that's different. So just that continual one-on-one, you get this whole variety of
Hmm.
mentoring. Oh,
Yeah. 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 Yeah.
that's
So we wrote about that along with another colleague. She's the associate DIO at VCU, Dr. Jacqueline Fuller, who you might know, but
good.
she was a co-author on that paper as well.
Oh, wow. Okay. Okay, Mr. Arthur. We can put Arthur behind your name.
So I forget about that sometimes, but I've been very blessed to have these
Yes,
opportunities.
yes. I love that. I like that, especially with the having, especially with having, there's not a lot of, Black professionals in our arena, right? So when you have, these ones, it's like there's always somebody you can look up to, especially if you're just
Mhm.
in this career, whether it's in medicine, in education, in, Arthur, or, having an Arthur behind your name, or, if you just want to do research, right? So that's what I have, like within the last, I want to say maybe 5 years,
Mhm.
I have seen it grow, so having that Black men, representation,
Yeah,
is key. It really is key,
it
um,
is. It is.
especially especially now.
Yeah, I mean, it makes me one of the reasons that I even started all of that was because I thought back to my experience in the diabetes center. So it's interesting how kind of that came up in a different way, but I thought about my experience and I was the only Black male staff member, even though I was a temporary staff because I was an intern, but I was the only Black male staff member in that center or in that program. And most of the patients looked exactly like me, but
Right.
most of the providers and the other staff members did not. And I remember seeing the patient's expressions, like when I would walk into the room and speak to them, especially if it was another Black male, in the patient bed, they would just kind of look, maybe surprised, and confused. And I remember some of them even telling my supervisors afterward, like, thank you so much for having him. And my supervisors are like, Henry, these patients love you. And at the time, I don't know if I thought about it so complex now, but now knowing that experience and everything we've been talking about with diversity and medicine over the last decade, I see now it's because they saw someone that looked just like them that was there to care for them. And that's important. That's important to the health and the healing process.
It's so true that you say that because as you're saying it, I'm thinking about even myself. Like when I go into the like a doctor's office or a dental office or even to get my blood drawn, um, I'm like, okay, yeah, it's it is a relaxing feeling. It's
Mm.
hard to say, but it is. It is a relaxing. Like, okay, I know I'm gonna be taken care of. Not saying that you won't anyway,
Right, right.
that you know
It's a comforting feeling.
very comforting. And it's
Mm.
crazy. I know, like, how, like, if you speak another language, but when you hear something in your mother tongue, you understand it, and you're
Mhm.
like, okay, I know exactly what they're saying. It's kind of like the same thing, right? So you go in, you may be getting your blood drawn. You're like, okay, yeah, hey, it's just comforting
Mhm.
when you go.
That's right.
Until you said that, it's like I've experienced it, but like to actually know, oh, I know exactly what he's talking about.
Hmm.
Yeah,
Yeah,
yeah.
yeah.
which is why we need more in the professional world, whether
Yeah.
it's education, medicine, whatever.
Yeah.
Um, we really do, especially in medicine, because it's like we know what we go through, we
Yeah.
know what we've been through, right?
Mm.
So I was talking to one of my girlfriends the other day, and she was looking for like mental health and someone to talk to, and so I'm like, well, just reach out to your EAP, da da da.
Right. Right.
Well, she's like, yeah, but I want somebody that looks like me because I'm pretty sure their past is like mine, so they will understand what I'm
Hmm.
going through and where I am now to know the type of help that I need.
Yeah.
So that I'm like,
That's so true.
you're right, you're right. I can't argue with that. You are so true because if no one understands what you've been through because they haven't
Hmm.
been through it themselves, then how do they really know how to help you?
Hmm.
So there's textbook, help, and then there's textbook slash personal experience help.
Yeah. Yeah.
And I
I
think
mean,
those are the best ones.
yeah. I mean, and even that thought came to mind when I was working in a more formal GME role, when I was a coordinator and trying to recruit more Black students into the residency program because we treat a predominantly Black population at the VCU Medical Center. So I shouldn't say we because I don't work there anymore, but that's what we did when I worked there, and they still do. But a lot of the interns coming in, particularly in those primary care specialties, and those more hospital medicine specialties, were not Black. So,
Mm-hmm.
I tried to push for that. So I'm not sure how they're doing now, but we actually were able to recruit one of the graduates of the Black Men in Medicine movement that I created into the internal medicine residency that I work for. So I knew him when he was a pre-med. He went to medical school, and then he matched into internal medicine residency while I was there.
Oh, yay.
So VCU did an entire like news article about it and showcased, like he went through that full journey of becoming a physician, and he started right here as an undergrad in this Black Men in Medicine group. So I would, if I was still there, I would, still try to do that work and recruit them. But, hopefully they're over there doing that work now.
Wow, wow. And see to see that like come full circle. Yeah,
Hmm.
is
Yeah,
amazing. And then
it was amazing.
of course Henry Lewis is the one who helped, you know what I'm saying?
Yeah,
Because of your starting it. Like
yeah,
if you didn't start it, you know? So
yeah.
it starts somewhere.
Hmm.
And that's where it started.
Yeah, it
And
did.
you got to think about where would he be? He probably would have ended up somewhere, but um,
Yeah.
that he has
A,
more than
a lot of them would have ended up, in medical school, who's to say? But I think having a targeted program or a targeted group where it's dedicated to your success as a Black man who wants to be a doctor. That was something that when at the time that I created, that was something that I didn't really see much of. In 2015, they weren't talking about that as much as they talk about it now.
like.
So, you know,
And then it's like support, like you're not alone, like you're not the only one, right? So they're coming in, and it's like, okay, you may have 5 or 10 or 20, but you see that you're not alone. You're
yeah,
here, just like they're here, and then it's like, okay, so what did you do? And it's like they can bounce things off of each other, or what did you go through? This is what I went through. This is what helped me, and then, like you said, with the mentorship as well. Good job. I like that.
thank you.
That
Thank you.
that that that's really something else that is really inspiring for just our community, in
Mhm.
itself. You know,
That's what it's for.
I want to talk about this certified healthcare education specialist. Like, so what inspired you to become this education specialist?
Yeah. So my undergrad education, but I finished that 2011. So it wasn't until 2021 that I obtained that credential. So 10 years later, I became a certified health education specialist, which I could have gotten 10 years prior. But because I went down a different career path, I just didn't pursue it then. I want to say in 2020, I was still working in higher education. This is when I was with the College of Health Professions at VCU. I was experiencing my own personal like health and wellness challenges. Really, really bad insomnia to the point where I just could not. I probably would go days sometimes without even really sleeping, and it was just really scary. Um, I went to the doctor, and for things like that, unless it's like an actual severe condition, there just wasn't a whole lot of treatment for, or nothing that's going to work like that, other than pills and just stuff that I just wasn't interested in doing.
Right.
Right. Right. So I started researching, what are natural ways to improve your sleep. And that's when I started learning about the like amazingly impactful role of nutrition on your health. I mean, we know that nutrition impacts your health, but I don't think we talk enough about how deep it is. It goes very, very deep. Our body is made up of nutrients. If
Yeah.
we don't have certain nutrients, we will have certain symptoms, but then we medicate it.
Right.
We don't think of it as like, oh, my body is telling me that it needs something. A headache doesn't always mean you need Tylenol. It really doesn't mean you need Tylenol at all. It's just removing the symptom of it all. What it's telling you is there's something your body is lacking, whether it's magnesium or whether it's water or whether it's iron or what have you. It could be a bunch of different things. So I started learning about the role of nutrition in sleep, which is another thing they don't talk about. So once I started reading about that, I started incorporating certain nutrients, changing my diet, taking certain supplements. And my sleep just started like just coming back to the point where I was sleeping like a baby. It was amazing. So
Really.
I said, I have to study this stuff in a formal way because I need to help others who are dealing with their own conditions.
Right. Right. Which can
I
be
left.
simple.
Mhm. Right. And at that point, I left higher education from an employment perspective
Mhm.
and went back to school to get a master's in clinical nutrition. I obtained my health education certification. I said, look, I'm already got the degree in health education 10 years, over 10 years ago. Let me get certified so that when I'm speaking to people, they see this, oh, he is an authority figure in this. And from there, I started my Lewis Wellness Solutions business and
Right.
started helping people from a natural perspective.
Mhm. So that really enhanced your ability to like contribute to health promotion and education like combined.
Mm-hmm. Yep, absolutely. That education, that the nutrition and everything wellness that I learned, I combined that. I said, well, I need to teach people how to help themselves,
Right.
whether that's in I do one-on-one consultations or whether that's in a group setting. I've done presentations, what have you. I need to teach people how to use these tools to help themselves.
Okay. So you can you can really do like if a program wanted a health and wellness type of consult for the residents,
Yeah,
for the nursing, for the GME staff.
yeah, yeah. Yeah, I'm actually in my current role with the Healthcare Workforce Authority. I'm actually starting up a food is medicine immersion series where a lot of our stakeholders can attend, whether you're a physician in training or whether you're a community health worker, because that's the other program I manage with the authority. You can come and learn more about nutrition and how it impacts your health and what resources you can connect people to in Virginia.
Wow. Wow, that's good. See, I kept seeing it, I kept seeing it, and I'm like, well, especially, in the Black community, like we don't necessarily eat, the right things. We don't necessarily, drink the amount of water that we really should. It's, Pepsi or Coke or, sweet drinks or what have you. So when I kept seeing you focus on the health and wellness,
Hmm.
um, I'm like, he's right. Like we need to make sure, like this is the only body we have, right?
Right.
To take care of it. Um, and that is really what I was like, that's right. You think about it, but when you constantly see it and it's in your
Hmm.
face, like we need to take care of our bodies.
Yeah.
That's like my grandfather used to take me. He would always say to me, as long as you take care of your car, it's going to take care of you.
Right. That's
Our
very
body.
true. The maintenance and the
Change all the time, the engine will run great. So
right.
if we eat, what we're supposed to eat, eat healthy foods, drink our water, make sure we're not overeating or grease or fry, then
Hmm.
take care of us. And that's one thing I know specifically with the Black community that we veer away from.
Hmm. Hmm.
The
Yeah.
education that you're bringing is great. It's key.
Yeah. 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 We have to because it's, unfortunately, our healthcare professionals are not trained in nutrition and these kind of wellness topics as much as they should be. So it's hard to, where are you going to get this information from? It's hard to seek that as a patient. So that's why I'm like, let me start this, and then let me, through my actual full-time job, let me help teach other healthcare professionals so that they can then go out and teach that to their patients.
And I was going to ask you that, like, why do you think it's important for healthcare professionals to contribute, like you are, scholarly,
Mhm.
different publications, presentations? Why do you think that it's important for that? It's specifically, in the Black community.
Yeah, because oftentimes we, especially in the healthcare profession, we talk so much about evidence and, oh, we can't say this or we can't say that because it's not evidence based. Well, if we start doing the research more and we start really publishing and presenting and really putting it out there in the literature and just in the public, in the media, all of that, then people are going to see how important it is because a lot of this stuff that I learned about the impact of nutrition and sleep, it actually is in the literature, but it just doesn't get promoted as much because it's, there's not a whole lot of, a whole lot of financial gain for, certain individuals. I won't get
Yeah,
into all of that,
yeah,
but
you're right though.
the politics of all of that. But the information is there. It's just not really promoted. But if we get it more and more into the literature, then maybe at some point it'll be promoted to the point where people really see how important it is.
Right. That's so true. That's so true. So, what do you think like the future, will hold for healthcare education and
Mhm.
specifically in terms of like diversity and inclusion?
Yeah, well, I think DEI in medicine and healthcare has gotten a little hit within the last within the
Very
last
true.
few
Very true.
years. But I think it's going to get to the point where everyone in general is going to see how important diversity, equity, and inclusion is to healthcare. It might take us a little while to get there, but I think that the sickness and illness in America is just getting worse. It's getting worse and worse every year. The life expectancy has gone down a little bit. Young people are getting all these different cancers that young people weren't getting before.
Yeah.
So things are just kind of getting out of hand. And of course, while all of that is going on, of course, the Black and brown communities are experiencing it even
Yeah.
worse.
Right.
So, because it's affecting everyone and then us even worse, at some point it's going to get to the attention of the people who make the decisions and things are going to have to change. So I think it's going to take some time, but I think it'll become a bigger priority at some point in the future.
Yeah. It's so right. So I say that all the time. I know we eat here, but um, what they are putting in foods now and
Hmm.
just
All the different processed ingredients that they didn't used to exist in
right.
food before, and people weren't experiencing as many health issues as they are now. So that's what I'm saying. Like things are just getting worse. So it's like at some point we're gonna kind of hit the fan, and things are just gonna go awry. And it's like, all right, we need someone to make a decision. What are we going to do? Because this is not sustainable.
Our food is killing us.
Yeah.
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 And nutrition is key, right? So what improvements do you think or you would want to see in the coming years? Um,
Yeah.
be more streamlined or, things cut out. Well, what would you like to see?
I have a laundry list of things. However, for the sake of time, uh, I would say the one main thing that I feel like we could do that would really change the game
Mhm.
is to go back to a simpler time where we weren't adding ingredients like high fructose corn syrup to everything, or um, we weren't spraying all of our crops with like pesticides and things like glyphosate and all these, all these different things that are foreign to our body and toxic really to our body. If we can just get to the point where we're not adding things to our food system,
Yeah.
and we would honestly improve significantly. And that goes without, I'm not even talking about like, oh, stop eating hamburgers and hot dogs and French fries, because someone made a good point the other day. I listened to a podcast. They said people were eating burgers and fries and drinking soda in the 1960s, but they weren't dying of the chronic diseases that we're dying of today. That's because those burgers and fries and sodas didn't have all that extra stuff in it
Yes.
that it does now. And in some countries, though, that extra stuff is actually it's regulated, and it's not regulated like that here.
Prohibited. Yes.
Yeah,
I
right.
remember a documentary about that, how like the chickens, they were like had this big syringe and they was just, shoving this stuff in the chicken. And when I went to the grocery store like months later, I looked down the chicken and I seen the holes. And I'm like, yep, not gonna get that one. Right. So it was a while, like I was like, I'm not eating meat at all because it's like, is it safe? Is it not safe?
Hmm.
Um, and then if it's, farm fresh or uh, getting grazed, like is it really?
Wild caught or
Yeah, yeah, all of that they put on the packaging now. But is it really?
marketing.
Is
Yeah, it's market. It's all of that stuff. If you're buying food from the grocery store, which is of course most people's access
yeah,
to food, a lot of that stuff is marketing. It's not really exactly what it seems it is, which is really concerning.
yeah,
So it's like in the future, I'd like to see transparency. I would like to see,
yeah,
stop putting all of this bad stuff in our food
yeah,
system.
that right there.
That's killing us over time. It's not a quick death. We're not dealing with all these infectious diseases that people were dying from back in the day. But now we're dealing with these chronic diseases, but it's just more and more. A lot of people have more than one chronic disease. It's not just one
Hmm.
anymore. So
And it
it's
does
not
start
getting
with what
better.
we eat. And to your point, it's like if we're eating that, that's in our, over the years, especially, say a woman, for instance, and it's in our blood systems, in our, our whole makeup, and then we have kids, right? So it
And
has,
that gets passed down. Yeah.
right, automatically.
Yeah. Yeah.
And, it could be in their egg, and now it's with that, and it just incubates
Mhm.
a child that is born with, like you said, cancer or some other, disease.
Yeah.
It really is what we eat. It really
Yeah.
is there. And just being healthy and cautious about that, is key.
Hmm.
It really is key. It really is
Yeah.
key. Wow.
And I'm hoping that with this nutrition initiative that I know the ACGME has with
Mhm.
some of the other medical organizations, I'm hoping that they really take that seriously and start incorporating it into all GME programs. So even if, because obviously I know that physicians don't have a whole lot of time to sit there and talk about all of that because of the model that they work in, but even if it's the lens that they operate under, like knowing like, okay, if this patient is presenting this issue, let me think of this more as a nutritional issue and be able to refer them properly than just simply let me take out my prescription pad and just, hey, just take this painkiller,
Right.
let
Right.
this,
It's like just
what else could this be? Let's get to the root.
right, right. Yeah, let's start with, let's pull back all the layers
Right,
and start with um, how's your eating habit? You know,
right.
you
They
drunk?
never ask that.
Exactly. Have you drunk enough water today? Like, are you hydrated? You
Hmm.
have this headache. Are you hydrated? You could be
That's
dehydrated.
the biggest thing is hydration. I think people don't think about that often. Like a lot of people are dehydrated. You might not be like clinically dehydrated where it's like you can't even get up off the floor, but you're dehydrated to the point where it's causing symptoms.
Yes, yes.
Hmm.
Living in Arizona, that I do know.
Oh yeah. Oh, definitely. Yes, yes. I've
Yeah.
only been there once, but yes, I had to hydrate a lot while I was there.
Oh yeah. Oh yeah. You'll see symptoms real quick. Real
Yeah.
quick. Um, so yeah, that I do agree. So you don't have to ask you this, just for fun.
Yes.
If you could only choose, and I'm gonna say books for you, two books, right? Only two books or resources. Um, what would they be and why?
Mm.
Hmm. And it could be something that, can influence your career. It could be, something for professional growth. It could be nutritional. What would it be?
No, that's a great question. So I would say the first thing that comes to mind is this book called Brave New Medicine
Mhm.
by Dr. Cynthia Lee. She's a internal medicine trained physician, but she actually I believe she gave up her license years ago to focus on helping people naturally. And she had an autoimmune condition that she was able to heal herself using nutrition and traditional Chinese medicine methods. But she provides information about her experience, but she ends with, now what can you do? And it's like a list of strategies and things, and some of it is nutrition, but others are just how to change the personal care items that you're using, or stress, how to get rid of a lot of stress in your life, because that's what's causing a lot of health issues too. So I just love the toolkit that she provides. And then I would also say a second book would have to be I think it's called, I don't have it near me, but I know it's somewhere in my house. The Food Prescription, I think is what it's called, by Dr. Baxter Montgomery. He is a cardiologist in Houston, Texas, who was able to help reverse a lot of cardiovascular issues and other health issues in his patients using a whole food plant-based like diet regimen. Like he has specific things he has them do, but people with clogged arteries and oversized hearts and things that we would normally tell patients, hey, this, here's some medications to help manage it, let's see if it actually works. And oftentimes, it doesn't work for everyone, but he's been able to like completely reverse it for some patients. So I think having those resources with me at all times, I know always have the tools to make sure that I'm healthy and that everyone else around me are healthy.
That's good. That is great information. That is a great answer. That is, those books, just from your description, it seems like it's a must read. I'm gonna have to really get those, and I'll have like the link or the description in the description for those books, um,
Yes, please.
because I mean, knowledge is power, you know.
Yep.
So why not share it for everybody? You know, it's one person at a time to just make a difference, whether no
Right.
matter how small it is, you
Right.
know. So those are two good books to have.
Yes. Yes, they are.
Uh,
You'll live a nice long life if the information and the content from those books, and you actually incorporate them.
yeah, and that's the key, incorporating it.
Yeah.
That's the key. Once you know, you have to move forward with, what you found out. You got to move forward. You can't just like get the knowledge and then
Yeah.
not do anything with it. All right. Thank you so much, Henry, for being here today.
Thank
Um,
you.
thank you for joining me on GME and Insights. And if listeners want to reach out to you, for nutrition, for health, for wealth, or just to, ask additional questions. Is LinkedIn the best way they can?
Absolutely. Yep, that's a great start. Yep.
Terrific. We've been speaking with the Henry Lewis,
Thank you.
a guru, educator in his own right. So reach out to him on LinkedIn. If you haven't already connected with him, he is a person to have on your LinkedIn roster. Um, but with that, we conclude another enlightening episode of GME Admin Insights. And remember, your dedication keeps the gears of GME turning and your growth matters. So until next time, community, we are out.
Bye.
Thank you so